And if you're taking the GO train or other public transportation to see your family this holiday weekend, you may want to protect yourself from COVID. Cases are on the rise in our area, and with people gathering in large groups to celebrate Thanksgiving, there is a risk of spread. As Laverne McGee tells us, don't be surprised to see more people wearing masks and getting vaccines.
Coughing, body aches, and congestion. COVID is on the rise in Hamilton. According to Dr. Dominik Mertz from Health Sciences at McMaster University, figuring out exactly how bad it's going to get may be difficult. During the pandemic, people were constantly being tested, and COVID numbers were publicized daily, but not anymore.
We do much less testing than we used to, so the case numbers aren't really helpful at this point of time.
Over 3 weeks in September, the 7-day average of new cases in Hamilton went from 11 to 22. During the same time period, the 7-day average of hospitalizations in Hamilton went from nothing to 0.6%, still very low. Hamilton Public Health Services has received the new mRNA COVID-19 XBB shot and is distributing it to hospitals. It's approved for most strains.
So there's not been one specific subvariant that has been dominant above all the others. There's been kind of a mix, but all of these subvariants still fall under the larger umbrella of the Omicron variant.
Halton is also seeing an increase in the number of COVID cases. Their community clinics began offering the new vaccine to high-risk individuals yesterday. They say they're expecting an additional shipment later this month and hope to offer it to the general population at that time.
It's hard to know exactly how many people are actually due for a vaccine at this point. I would say right now we've got lots of availability for those people at high risk. So if you're looking for a dose, come book an appointment by going to halton.ca/COVID vaccines.
As for the province of Ontario, the Ministry of Health is reporting the following confirmed COVID-19 cases up to September 23, 2023. 2,801 recent cases, 15 recent deaths, 209 recent hospital admissions. We made several attempts to get the very latest COVID information from the province, but our requests for interviews were denied. Opposition leaders also agreed that more transparency is necessary.
There's risk for our families, and especially those who are vulnerable, seniors. And so I would expect that the medical officer of health would be consistently out there trying to give people the best advice he can to make sure they're safe.
Officials say it's not time to panic, it's time to protect yourself. Laverne McGee, CHCH News.